Hi, my name is Dr. Mary Ann Bender, and I'm a podiatrist at Weill Foot and Ankle Institute's Oak Park office. Last weekend, Aaron Rodgers of the Green Bay Packers developed severe big toe pain, he said, that was worse than turf toe.
That it was more painful than turf toe. And I had turf toe years ago, and the problem with turf toe is that, it's that joint in your big toe, and it is very painful.
So you might be asking, what is turf toe? Turf toe is an injury to the big toe joint where the soft tissues get inflamed. It is usually due to a rapid hyperextension of the big toe joint. This is common in professional football players that are playing on artificial turf because their foot might be planted on the ground and then they're tackled, rapidly hyperextending this joint. Now, other people can get this as well. Gymnasts, runners, soccer players that play on natural surfaces like grass and are wearing shoes that are not supportive, especially in the forefoot, are also at risk for this injury. Now, what do you do if you think you have turf toe? Think rice. Rest, ice the area, compression, which means strapping the toe, and elevation. Often, this will feel somewhat better in a few days, but if it doesn't, you need to see a podiatrist for additional imaging, such as x-rays or MRI, and sometimes the foot needs to be immobilized with a surgical shoe or strapping. Often we'll also employ physical therapy, ibuprofen or other anti-inflammatory medications, and more advanced strapping of the toe. If you think you've injured your toe and you think you have turf toe, don't hesitate to give us a call. Thank you.